Well, good morning, everyone. This is Tustin Longevity Center in Tustin, California, Southern California, and I am Dr. Ellithorpe with Tustin Longevity Center. We are a group of 5 healthcare providers, and we've been here for over 20 years. We are here to try and answer random questions. This is for educational purposes. And we are not trying to answer any one specific question. And here is Talon joining me, and we will try and give you how a alternative, complementary, functional, integrative doctor would try to handle the questions as they come to us in the office. But again, this is not personal management. You would have to see your local doctor for that. But it's so good to see the TLC Health Freedom Tribe here showing up. We're doing this on Fridays at 10 o'clock in the morning. And so hopefully you'll share this with your family and friends, and we'll try and get through as many questions as we can. All right. So I guess, Helen, how are you doing? Thank you that you could make it.
Yes, thanks for having me, and thank you everybody for just being mindful of the emails going out and the change in the times from Wednesday to now Fridays. It looks like we'll stick with Fridays for the time being, but of course the best way to stay up to date is either just tuning in to the weekly live streams, which will let you know anything that is coming up as soon as we know. And of course, hopefully you are all on the email list and you're receiving those emails from us, letting you know when we're going to be doing a live stream. We've had some changes to doctor schedules here. We have 2 of our physicians either out or going out on maternity leave, so it's definitely having an impact on our schedule here.
We're so happy that Dr. Kaur had her little girl.
Everything
went well. Beautiful,
yeah.
Healthy child, home delivery.
That's right.
So how exciting, and what experience she offers when she comes back to all those looking for natural home birth.
Yes. All right, great. Well, I can see we're getting some questions in on the chat, which is great. And we have had some questions emailed in. I don't have those with me today, but we'll make sure that we answer those on a follow-up. And I think what I'll do is I'll try to put those together for your Monday evening one.
All right.
So if you have emailed us a question, we will try to answer those Monday evening or here next Friday. Our email lately has just been getting inundated with tons and tons of questions, regular patient questions and such. So I'm trying to make sure those don't get lost in the shuffle. But the best way to always interact with us is right here in the chat. Mm-hmm. So let's go ahead and dive in there. We're getting a question here from Amela that says, my friend's son's vitamin D level came back at 22. He's 13. He sometimes gets headaches that don't last long. They come and go. All blood work came back normal. Could low vitamin D levels cause headaches?
I've never heard of vitamin D being associated with headaches. Mm-hmm. It's more common that at 13, he probably needs an optometry appointment and have his eyes checked for his visual acuity, seasonal allergies, depending on where he lives, the stress, how much hours he's putting in on computer, how late he's staying up at night, that kind of stuff.
Right. Yeah, those are definitely the top hitters for eye strain, headaches, that type of thing, and also water.
Correct. Yeah.
Most people just do not drink enough water, and dehydration is a very common side effect is headaches.
But of course, if it persists and you have been drinking the water and you are having an eye exam and you don't have any need for correction and the headaches persist, then you should see your doctor and pursue further steps.
Okay. Garden Fairy says, by what route is preferred for progesterone in conjunction with estrogen patch?
Mm-hmm. Well, this is very personalized. That's why you see a doctor and you manage it together with your doctor. I like to start women on topical creams because we're in an adjustment phase. That means if I order it in an oral capsule form, you're stuck with 30 of those or 90 of them, okay? And I can't adjust it very well. So when we start with topical creams, it's the least invasive, it's the most manageable. patches have the ability to be cut, but it becomes a little bit more cumbersome. But patches you can cut in half or cut in thirds,
Right.
and we can adjust that. So I like the topical approach first.
Because it's very easy to adjust. 1 click or 2 click or 3 clicks.
Yeah, or subtract a click.
Yep.
And your doctor should follow you up. I like putting estradiol on my face, though, and you're not going to wind up putting a patch on your face, you know. So I can actually directly get estradiol on my eyes, on my eyelids, and around my lips, so I don't get all the wrinkles of aging at the rate that most women do. So that's one of the reasons why I stick with the topical estradiol, because I can put it right to my face. I like putting it where the veins are on your wrists. The progesterone can be put really anywhere. The progesterone I like as a cream. Again, this morning I placed mine on my wrist where my blood vessels are because I put my estrogen to my face. I tend to use my hormones in the morning. If you want to have sleep enhancement, it tends to help if you use it at night, but I sleep very well anyway, so it doesn't matter to me personally whether I use it in the morning or the evening. Some women do much better if they use it in the evenings. I don't have anything against oral estradiol tablets. You know, once we find something that works for you, and if you're young enough and you're not facing facial wrinkles and stuff, and your collagen level is good, your digestion and protein absorption is good, then a oral tablet is fine as well. I don't like the pellets. I don't like anything with a big depot deposited under your skin mixed with fillers. I am really against that. I've never had any success really long term with people who do that.
Okay. Yeah, that's invasive and traumatic as well too.
Right.
And once that is put under your skin, it's there, and you're going to have a large spike and then a drop off as the ingredients are absorbed. Okay, Debbie says, as we age, how do we keep the lumps and dimplings off our arms? I'm not overweight and I work out, but at 60, my arms are getting dimply. Do you think fascia blasters or dry brushing help at all? Thanks.
You know, your blood type matters. If you are a blood type A, you're going to have less digestive enzymes, less systemic enzymes. Enzymes help with tissue inflammation, bodily inflammation. And so I think adequate hydration, using an orthodigestive enzyme that has betaine hydrochloric acid in it with all the digestive enzymes, because you have to absorb the proteins for your collagen and elastin and fibrin and production in your body. I believe in natural hormone replacement as well. You should have your DHEA level checked to look at your testosterone level, and that'll help your muscle tone. So we're trying to keep the thickness of our skin at its peak performance. So you need to be well hydrated. You need to get enough sleep, because that's when you heal at night and the body kind of evens out, you might say. So a lot of repairs are done then. As far as all the skin topical application, I have never in 40 years seen this to be something that is effectual. I just haven't. So I would focus on digestion, get that protein in, check your hormones, including DHEA and testosterone. Find a doctor that helps you with that, managing it to optimal levels. Be well hydrated, get a good night's sleep, exercise, and take your enzymes. Beyond that, I don't think that there's much you can do.
Okay. Margot says EDTA suppositories made by Detoxamine currently use a proprietary natural triglyceride base. Since the original base is no longer made, is triglyceride preferable to cocoa butter as a base? The gold standard IV method is not feasible for me.
I'm going to say that the triglyceride is really the smallest fatty acid that is out there that has any structure, and probably is better absorbed than the big cocoa butter. And so I would say that sounds smarter. Now, I don't have any involvement with Detoxamine. When we did research originally, I used it under a prescription base here many, many years ago, about 14 years ago, 15 years ago. We did good studies with it, and the proprietary base that was involved back then was very effectual. Cocoa butter and glycerin suppositories are probably the lowest delivery for the medicine, the effective ingredient. But triglycerides sound more promising. And I'm not endorsing the new Detoxamine or wherever you're getting it from, because I don't think you even can get it in the United States.
Yeah, I'm not sure whoever's using the name Detoxamine, if they're at all even related to the Detoxamine that we knew and that we worked with years ago. I know, unfortunately, they're still using your name and some of your statements, and it looks like they might be out of the country. But to be clear, EDTA in the United States is considered a drug, and it shouldn't be something that you can order off of the internet from anywhere. So we really can't vouch for that name brand anymore. And when you do write prescriptions for EDTA suppositories, but we send it to a local compounding pharmacy here that we trust and that happened to work with the company Detoxamine back then on the base and the formula, so that we knew what our patients were getting was what we had done research on.
Right, correct.
Okay. I read your published results on EDTA suppositories using 750 milligrams. Has the 1500 milligram clinical trial been published? Well, you published on both, right?
Mm-hmm. Yeah, we used the 1500 milligram with the men in that study.
Yep. Okay. Hi, Dr. Rita. What are your thoughts on cataract surgery?
Well, if the lens in the eye has become so oxidized, which is to say burnt, you might say, that the proteins congealed and clouded up your disc of your lens, then you have to address what you're going to do about that. That lens was designed to have little ciliary muscles on either side of the lens so that when you're looking near at something, it can bunch up and the muscles relax and it can expand into a thicker bulbous thing. And if you're looking far, you can tighten up the ciliary muscles and look in the distance. If your lens gets burnt, oxidized from inflammation, a poor lifestyle or just with aging, then you have to eliminate that lens. There's no way around it. So the surgery of lens cataract removal is so advanced. I have really seen my patients do very, very well. I have my optometrist is seeing me on a regular basis, and I come to him, and he is very pleased and amazed that my lenses have no sign of cataracts as I approach 70. And I really attribute that to everything we teach here: the water, the low carb, the exercise, the good night's sleep, the enzymes, and then especially Juice Plus from the antioxidant, stopping the free radical burn. Remember, we are all a 98.6 roast. We're slowly roasting. That's why you got to drink your water to help modulate the temperature and stuff so you don't burn up too fast.
Okay. What is the best thing to do for hip capsule pain to prevent problems? X-rays showed nothing, but it's gone on for 3 weeks.
Hip capsule pain. Well, it depends on your weight, on your age, prior trauma,
mobility.
Yeah, and do you have any hormones left in you? Are you drinking enough water? Are you taking systemic enzymes? Is your blood type a type that easily digests protein so that you can help repair the capsule, the collagen, mucilaginous material there? What is the state of your cardiovascular health? One of the reasons why we promote EDTA chelation intravenously, primarily over suppositories, although, I'm not going to say don't do suppositories, is because the capsule and the cartilage in your body has no blood supply to it. So the cartilage in the tip of your nose, in your ears, between your vertebrae, between your joints, all tendons have no blood supply. They're totally dependent upon you drinking enough water. It's totally dependent on you having some exercise and nighttime good sleep. And so if you bend to your right, your vertebrae are pinching the right half of your vertebral disc, and they're squeezing out the water. And then when you sit up again, then it is what is called imbibition. The disc sucks up the local water there with the nutrients that are in it. So microcirculation has to come so close to that cartilage, and the to try and help transfer the fluids and the nutrients. And you must have good microcirculation. You must drink the water. You should not clog it up with a high sticky carb, food allergy, clumping, antibody, inactive, dehydrated, and you're going to just have that problem. So I would take, Vitalzyme or Vascuzyme. I would take 5 or 10 twice a day or 3 times a day on an empty stomach. I would fast, and that will force you to drink a lot of water and get a good night's sleep. And hopefully you're on hormones, or you're young enough to have your hormones, and see how you do. If that doesn't help you. With normal x-rays, it doesn't sound like the person is that old.
Right. Okay. Any thoughts for preventing stretch marks and minimizing current stretch marks?
Well, everything that I've said before, healing is the same pattern everywhere in your human body. Stretch marks are scars. They are literal scars in the human body. And really, there's no reformation of scarring. This is not well addressed with research, other than to say that scars are permanent. And you probably have scars from your childhood that are still on your body. So stretch marks are just there. And what you want to do is to try and prevent further strain on your tissues by the healthy lifestyle, knowing your blood type, taking your enzymes, eating the healthy proteins. Remember, we're made of protein and fat. We're not made of fruits and vegetables. We consume fruits and vegetables for some fiber and the micronutrients and the vitamins in them and minerals, but we are not composed of those things. Yet we eat as if we're composed of fruits and vegetables, and we hardly get in enough reparative, restorative protein, amino acids, and healthy fats for our skin, and for the skin to handle the strain and the turgor. So like when you're getting pregnant, I don't think I have any pregnancy scars from you or Brighton. I think that's because my father in food research was always emphasizing to eat the protein and the healthy fats. Now, there are those who, it's a wives' tale. Take vitamin E, rub vitamin E on your stomach. That's all wives' tale. If anything would be valuable, it would be the clinician's preference oil that contains linoleic and alpha-linolenic acid, the very essential cell membrane of the skin, and of course all cells in your body, orally and topically. I have people with eczema apply it topically. I just saw a lady a few days ago, and she was a new patient a few weeks before that. She has terrible hand palmar eczema. That's terrible because you got to wash your hands and care for your children and cook. So she was already improved by taking the essential oils, and I do believe her blood type was A. But yeah, that's all I can say about stretch marks and scars.
Okay. What do you think about using psilocybin mushrooms to manage stress and anxiety?
There's a lot of research in plant food. In fact, pharmaceutical industries really study the plants to make up the copycat molecule to patent it to make their drugs. That's essentially there. And they very limitedly popularize any of this research. But psilocybins and the THC and the CBD receptors that are on all the cells are very much associated with positive impact. I don't know the source of what you're getting it from. I hope it's a good and reputable, good general manufacturing quality sources. But I think that there's a lot of value in this research and help to the patient for stress.
Okay. Okay, Manuel says, my wife unfortunately had a very early miscarriage. She heard it is important to help clean out the uterus in preparation for trying again. Any thoughts for non-invasive natural help?
Well, she had a natural miscarriage.
I said a very early miscarriage, so it sounds like it.
So she probably didn't have a DNC, dilation and curettage. So if the pregnancy is lost really prior to 8 weeks, there usually is no complication from any retained products of conception. And using natural progesterone augmentively from day 15 to 25 of your menstrual cycle is very wise, especially in trying to time when you're going to have sexual relations to try and become pregnant again. And the progesterone itself will help cleaning the uterus out. That's the role primarily of progesterone, is the signal to produce the shedding of the lining of the uterus monthly. So about day 8 of every woman's menstrual cycle, from day 1, the start of her period, somewhere between day 8 and day 15, that 7-day period, 1 week out of every month, is the fertile time theoretically for a woman. And if she has relationships and the egg is fertilized, then the uterus is building up the estradiol to thicken up the lining so that that hopeful egg implants in a healthy, well-rich, oxygenated, bloody lining of the uterus. Then, of course, we hope that the corpus luteum, where the egg came from, is producing enough progesterone to help sustain the pregnancy, okay? So I think using progesterone cyclically will help with the regulation of the cycle from day 15 to 25 of the cycle. That way it won't inhibit ovulation, because women ovulate between day 8 and 15. So if you start day 15 to 25, you'll have a better regulation. It'll clean the uterus out. Now, I'm all in favor of a powerful, healthy protocol. We put our women on an iodine tablet, 12.5 milligrams of iodine every day to have more iodine and a better mental development of the baby. We have all our women on vitamin D, at least 5,000 international units of vitamin D3. We have all our women recommended to take Juice Plus to help the oxidative stress be so reduced. Because remember, that baby is only getting oxygen from the blood supply, initially from the lining of the uterus, healthy blood cells in the mother, and then eventually through the blood of the placental connection. And the antioxidant levels in women on Juice Plus are just fantastic. And the placentas that develop from that are coveted for research because they're so healthy. And then we ask them all to be on a good multi-mineral vitamin. With that, and then the cyclical progesterone day 15 to 25, I think they should do fine. That'll help clean it out.
And post-miscarriage, wouldn't enzymes be important?
Yeah, well, we would assume if she makes the enzymes herself. Mm-hmm. You could, if you're a blood type A, your enzyme production might be diminished. So systemic enzymes, 4 or 5 once or twice a day on an empty stomach would assist with this. And you could take that, even if you're not a blood type A. But yeah, that's reasonable with good hydration.
Okay, my hands and feet are cold and fall asleep easily. Do you know why this might be happening?
Well, with age, the microcirculation diminishes in the most external parts of our body, including the brain. So if you do a series of MRIs, CAT scans of the head on adults that are getting older, you'll see all brains shrink. And that's because cells are dying because the tiny little hair-like, thread-like capillary is getting clogged up with life and lack of water and lack of enzymes and so forth. So the same thing's happening with your hands. So microcirculation is diminished there. Hypothyroidism is very often another related issue with your metabolism, whether or not you're exercising on a regular basis, whether or not you're hydrated with enough water, whether or not you have a lot of autoimmune phenomena from having a leaky gut with low-grade inflammation with antibody complexes that are clogging up all these capillaries. So enzymes would help there too. Mineral, being magnesium deficient to help relax the smooth muscles and the arterioles to promote the fluid flow of the capillaries. So we give chelation therapy for microcirculation. We give iodine to potentiate, optimize your iodine so that you have better thyroid function. If that's not enough, then we give you natural thyroid hormone. We stress the good, adequate hydration. We emphasize an aerobic, regular exercise protocol, plenty of sleep, and systemic enzymes to try and clean out like soap suds so that hopefully your brain won't shrink at that rate. And then, of course, hormones help the repair mechanism. So those who use hormones will live longer because of the increased, general contractor role of the natural hormone replacement.
Okay, great. Jan says, I am type O blood, but not sure if A or B. What is the difference between A and O? Is one better than the other, less risky for disease, etc.? Thanks, Jan.
Every blood type has its own liability. So it's not like saying one blood type is better than the other. My understanding over the many decades and looking into blood type and its impact for predictive health, preventive health, is that if the A-type blood person is managed by an informed doctor or team, and this is usually your Olympic athletes who are being developed from childhood on, they all know about the research on blood type. And so A-type blood people, I believe, are probably the bearers of most of the gold medals that have ever been won in history. So the A-type blood, I think, has a very healthy, fantastic, superior body in that way. However, if you are not aspiring to be an Olympic athlete, you're never going to get around intense research on optimizing your health and function, and you'll never learn about blood type. You'll be enzyme deficient because all those athletes who are A's are on enzymes. And you'll wind up having a deficit if you're a blood type A of poor digestion of your proteins and fats, which means your life's construction of all your body cells and tissues as you grow is going to have to struggle harder than the B or the A or the AB or the O-type blood. Now, the liability of the O-type blood is kind of like the opposite end of the spectrum. O's make almost too much acid. Theoretically, they tend to be the guys who get the stomach ulcers. They'll get the arthritides in life from excess acid production and irritation on the lining of their gut from their own acid production, whereas the A's will eventually get stomach breakdown from the inactivity of digestion and the repair of their lining. So one's a lack of repairing the paint on the exterior of the house and the shingles, and then it breaks down and it leaks. The other is you're having too much acid and there's so much hard weather and hail hitting the shingles of the roof. It's got holes from the hail, not because it's an old worn out house that doesn't have a good repair rate. So, and then the A's and the B's and the ABs are all kind of like a mixture. In general, B's tend to have a much more activated allergy to pollens and things like that. Something with their genetic background on their histaminic and mast cell degranulation seems to be hair triggered at any perfume or anything like that. That's why I never wear perfume. I'm the B type super allergy person. So are you. And you can get irritated eyes and stuff like that. Then the AB is kind of a blend between allergies and a little maldigestion. And so that's the story, just try and find a good functional doctor that really spends the additional time in practicing medicine to become informed with this whole world of botanical medicines and research on preventive aging and mitochondrial aerobic function of the respiratory chain in your mitochondria and taking care of your cell membranes. And this takes research, and they don't teach this in medical school.
That's true. Okay, well, it is 10:30, so that is our half hour for today. I want to thank everybody for joining us. I know there's a couple questions we didn't have time to get to. Dr. Ellithorpe will be back here Monday evening at 6 p.m.
Yes.
And she tends to spend a little bit more time. So sign in early and repost your question there on Monday, and we'll be sure to get it answered. We'll be back Monday, 6 o'clock, and then we'll be here again next Friday at 10 a.m. So we look forward to seeing you then. And until that time, everybody, be well and God bless.
God bless.
Thanks for joining us.